So let's talk about doing the right plastic surgery procedure the first time. I'm Megan Drevscott. I'm a board certified plastic surgeon, and no one wants more surgery than they need. But do you really want to pay the cost, go through all the time of recovery and the risks of having surgery just to get a subpar result? Probably not. As a plastic surgeon, I see this in two very common scenarios in my patient population. The first is women coming in for a breast augmentation when they really need a breast lift. The second scenario is somebody who's coming in for a tummy tuck, wants a mini tummy tuck instead of a full tummy tuck. Now, why is this a problem? If you need a breast lift, you need a breast lift, and you can't simulate that with just an implant alone. So if I am only giving the patient half of the surgery that they need, then rest assured when everything is said and done, they're going to be unhappy. It's the same thing with a tummy tuck. What I've noticed is that the perception between a standard tummy tuck or kind of a full tummy tuck and a mini tummy tuck are that a mini tummy tuck is so much less surgery and thus so much more desirable. And while the surgical procedures are different, when it comes to the final scar, a mini tummy tuck is really only saving you a couple of centimeters. Now, what these things are not saving you is having to go back and pay for a secondary surgery to actually get what you need. So for example, I just finished a tummy tuck on a patient who went to Beverly Hills, got tucked into a mini tummy tuck that was supposed to be some sort of hybrid. She ended up, when everything was said and done, being unhappy with her belly button, which really doesn't have anything to do with it. But she still had loose skin above her belly button because the mini tummy tuck doesn't address this. At the end of the day, the patient needed a full tummy tuck, and 2 years later, she's in my OR, and we're actually doing that. So she could have saved herself a lot of time and a lot of money just getting that procedure done the first time around. Now, sometimes it's the patients that drive this desire to want a lesser surgical procedure and expect a different outcome. But sometimes this comes from the surgeon itself. There are very gimmicky things that some surgeons offer. And I think just from a patient perspective, it's sort of like buyer beware, but also just remember, if it sounds too good to be true, it probably is. At the end of the day, there's no harm in getting a second or a third opinion so that you can just test the waters, see what other surgeons think, and then make the right decision for yourself.